Let's talk about knee stiffness. This is one of the biggest issues that most people experience after they have a knee replacement surgery. We'll talk about reasons why people have knee stiffness and ways we can address this. To better understand why you get knee stiffness after a knee replacement surgery, we need to understand what's going on with the body. When you undergo a knee replacement surgery, your body is going through an enormous amount of stress and damage. And typically, what happens when your body goes through damage or stress of that magnitude, you typically see a repair process that causes inflammation or swelling, also pain, redness. The pain is the biggest limiting factor that prevents people from being able to move their legs effectively after a surgery. And typically, what happens is they don't move well, and after a period of time, the leg gets even stiffer. The swelling is another reason why some people get decreased range of motion. Even if it's not as painful, it just feels full and stiff overall. That swelling in the knee joint prevents the knee from bending fully. Now, we'll kind of talk about those processes a little bit more and understand how we can address it, okay? So, with swelling, that's a normal process that occurs after you have an injury. There's increased fluid that leaks out into the tissue. A way to test if you have swelling, just look at the leg and compare both sides and see if one's you know tighter or looks more shiny than the other side. Also, you can just see if it looks bigger. Another way that you can kind of see how much swelling you have is just take your finger and just push firmly into your skin, wherever that area is, and just hold it there for about 5 seconds. Now take your fingers off, and if you see the indentation or a mark where your finger was, that means you have a type of swelling that can easily be removed from being active. So try those and see how much swelling you have. If you don't have as much swelling, you probably don't need to go as aggressive with managing the swelling, and it might be more of your pain that's bothering you and limiting you from getting the full range of motion. Now, if you do this and you have a lot of swelling, that might be more of a reason why you're not able to fully move your knee. So do that first test and just kind of see how your leg is looking. The next one is pain. Now, pain is the biggest limiting factor. Regardless of how much swelling you have, typically people have pain after they have this surgery. There's the cut from the incision site right on the skin, also deep inside. So the cut that you see is only the surface of it. You have to remember with the knee replacement surgery, they are cutting part of the bone and replacing it. So there's a lot of damage inside of the knee joint. So all throughout, it's just that achy, painful sensation. So going all the way deeply into that knee joint, we see a lot of pain when people do try moving that knee. And that is what limits people, especially once they get towards the end ranges. They could probably move about this much, but once they try straightening their knee all the way out or bending it even more, that's when you typically see more pain associated with movement. Now, this is initially good because what happens is when you have that cut, you want that incision where the surgeon cut through your leg, you want that to heal properly. And in the beginning stages, pain is a guide. It lets you know how much your body is able to tolerate, and it protects you essentially. Because if that incision is not fully healed and you stretch it out too much, well, you can have the incision open, and you'll probably need to go in again and see your surgeon for them to fix that. So take it easy for the first couple of weeks, but keep it moving. For the first month, you want to gradually increase how much you're bending your leg so that it doesn't get stiff. Now, this is the third part where people have that stiffness and it stays for a long time after they've had the surgery. If because of the pain and the swelling, if they did not do the proper take the proper measures to reduce those, they're not going to move as much. So if you weren't moving as much the first 2 weeks, maybe the first month when you had your surgery, you'll notice as your leg gets a lot stiffer and it becomes a lot harder for you to go bend that knee or straighten it out. Now, eventually, after a while, this becomes what we call contracture. Contracture just means that leg is really stiff. Imagine playing with silly putty. Now, when you take the silly putty out, you're playing with it and you keep moving it. It stays nice and soft and you're able to still move it. But if you leave that silly putty for a while, it hardens and it becomes stiff and rock hard. And it becomes really hard to move it. Well, that's kind of what happens with the knee after a while. If you don't move it through its full range, it eventually just stiffens up and it's harder then to take it outside of that range of motion. So it's very important within the first month that you do try getting the knee bending and straightening out as much as you can. So these are all ways that you get that stiffness after your knee replacement surgery. Remember, it's important to get the knee moving initially after you've had the surgery. Think about for the first month just trying to continuously work on getting that knee straight. There will be some discomfort associated with this, but it does get better as you go. And remember, if you hold it for too long, the knee gets stiffer and then it becomes even more painful later on. So work through the discomfort. I know it's not the best feeling, but it will help out in the long term and get you back to where you were, living your life normal and going about your usual activities. So prevention is key, and you want to make sure you're preventing the knee from getting stiff in the first place. On the next video, I'll show you ways that we can prevent the knee from getting stiff with different activities and exercises that you can do at home. That's very simple. Now, if you have any issues and you're not seeing the progress that you need or that you desire, you can always go see a specialized healthcare provider who can help you out with this problem. Thank you for watching this video. I hope the information was useful for you. Go ahead and check out the rest of our videos and see ways that we can help you achieve your health goals. Thank you.